Now we're going to kind of meet the winning companies. About 90 seconds each for them to introduce themselves, what problem they're solving, how they're solving it, what are some of their accomplishments to date. I'll try and ask a smart question to follow on.
Hi, everyone, and thanks also for highlighting pediatric health because I think it's very underserved. I'm Francesca Watke. I'm the founder and CEO of NEN. The WHO reports that over 400 million kids are in pain, and so pain management is a fundamental human right. And I founded NEN to help these kids through our digital platform. So we're a clinical stage company that's developing evidence-based digital therapeutics to help kids fighting cancer, their families, and their doctors manage pain. We're starting with the pediatric cancer space since these kids are really high risk of medical trauma and these negative pain memories can be really sticky. In fact, 59% of adult survivors of cancer have pain. So tackling the psychological aspects of pain is not a nice to have. It's really a necessity, and we need new approaches to manage and modulate pain. There aren't enough therapists to treat these kids, and most families have to wait about 12 months before getting in. We could use digital solutions to bridge this access gap, but very few solutions are built specifically for kids. And that's exactly what we're endeavoring to do. Kids matter, and we're committed to kids. We're addressing pain management through play by leveraging gamification of cognitive behavioral therapy to modulate pain and improve their overall outcomes and well-being. We launched earlier this year, which was really exciting in the US, UK, Spain, and Portugal in English, Spanish, and Portuguese. And we're excited to continue expanding across the US and Europe.
Thanks. Can you give us a real quick vignette about how a pediatric oncology patient would use NEN?
Yeah, so it's a game that they play. We've created virtual companions that help guide them through the journey through NEN. NEN is a world. We have Dolores, which means pain in Spanish. I'm based in Barcelona. Dolores delivers cognitive behavioral therapy related to pain. And then we also have Sarah and Tony, and Sarah and Tony focus on the serotonergic receptor pathways. Sarah focuses on anxiety and Tony on depression. So it's really important to address mental health as well as pain in these kids because it has a huge impact on their interpretation of the pain. We've also spoken to a lot of parents, and the one thing that's been really overwhelmingly consistent is how frustrated they are with access to care. So we've created a suite of services specifically for parents to help them help their kids get the best outcomes out of the CBT.
As we know, again, I'm trained in pediatrics and internal medicine, but we've also seen a dearth of solutions in the pediatric space where they don't get adopted or paid for, just like in the challenges across the adult world. What lessons have you learned that are unique to getting solutions out into the kids space, whether it's a pediatrician, physical therapy, and beyond? Any kind of quick lessons or insights?
It's so important for platforms within the pediatric space to be really fun and engaging for kids. We've spent a really long time and right from the beginning having our kid advisory board, our NEN testers, because who better to tell us about the product than the kids themselves who are going to be using them. So, that's I think one of the biggest challenges with designing and developing solutions for kids. Kids aren't one thing. There's a spectrum between infancy and adulthood. So figuring out what age range you're going to be focused on. Lindsay, you were saying you have partnerships with Sesame Street, which is great for the littles. They can really relate to that. So I just wanted to reiterate how important that is to really design a bespoke product for kids.